Okay. Good afternoon, everyone. Today I will be your teacher. This profession for today is nurse aides. Okay, this is my syllabus. There are 4 units for this class. I choose the unit number 2 with the item 2.1. Sorry. The topic for today is about the medical tour. This is my lesson plan. There are my resources. We use laptop, video TikTok, Canvas slides, and many tools that I show you to pass the class. So now let's start with a class. Hey, good afternoon, guys. Today I will start with a little questions about this profession. Do you know or what comes in your mind when you hear nurse aides? Can you read somebody this part in the cloud? Nayeli, please. Can you read this?
Yes, nurse aides take patient vital signs, including temperature, pulse, breathing rate, and blood pressure.
So, yes, nurse aides is a healthcare professional who assists nurse with patient care, right? They work in hospitals, nursing homes, and other healthcare facilities, helping patients with activity of daily life, such as bathing, dressing, and eating. So this is the unit that we work in today. Unit number 2, hospital object and areas, with the item 2.1 medical tools. So let's start. The objective for today's class is to identify and describe basic hospital tools used in daily medical practice. So,
What is this?
we have a little warm-up. It's about a guest activity, right? So you look at this picture and you guess what is the 3 options that you can see in these questions. For example, in this part we have a picture, and then we have 3 options: a stethoscope, a stethoscope, on defibrillator.
Letter B, stethoscope.
Letter B.
It's a stethoscope.
Yes, good job, Nayeli.
What is this?
So now, what is this? Thermometer, barometer, or thermostat? What do you think? Letter A, B, C. What do you think?
Letter A, thermometer.
Yes. Oh, sorry.
What is this? It's a stethoscope. What is this? It's a thermometer.
Good job, Nayeli. Thank
What
you.
is this?
So now, what is this? What do you think? Pipette, EpiPen, or syringe? Nobody knows.
Syringes, letter C.
Letter C.
It's a syringe.
Oh, good job, Nayeli.
What is this?
What do you think is that picture? Nebulizer and Laryngoscope, otoscope. That easy. You can use in your ears when you check that.
Letter C.
Letter C.
It's an otoscope.
Hey, good job, Atlas. Thank you.
What is this?
What do you think it is? Letter A, B, C. Letter A, blood pressure monitor. Letter B, heart rate monitor. Or letter C, pulse oximeter. What do you think?
Blood pressure.
It's a blood pressure monitor. What is this? What is this?
Okay, thank you. That's it for the little activity about this. So now we are going to learn about the basic vocabulary of the hospital tools. And the first, we have a thermometer. This is a thermometer. Can you see that? This is a thermometer. Are versatile tools used to measure temperatures in various settings. And they are commonly used in medicines to check for the fever, right? Okay, next. The ambulance. This is an important vehicle we use when you need transport to a patient. So, Detlys, please, can you read the meaning of the ambulance?
A vehicle especially equipped for taking sick or injured people to and from the hospital, especially in emergencies.
Okay, that's right. Thank you. Band 8. Look at this. So in many cases, we found a lot of ways to, or a lot of shapes. You found these band aids. In this case, we have this like a circle. So band aids are primarily used to protect minor cuts, right? Minor cuts, scrapes, and wounds from dirt, germ, and further injury. So now we have bandage. Can somebody help me with the lecture, please, with the reading? This is a bandage. Jose, can you help me?
Sure.
Thank
Okay,
you.
bandage. Bandage are primarily used to cover and protect wounds, secure dressing, and provide support or compression to injured areas.
That's right. Thank you. This is a bandage. Are primarily used to cover and protect wounds. Next. So now we have a blood pressure. This is a blood pressure. Can you see that? This is a blood pressure. This is a tool that measures the force of blood flows through a person's body. So now I'm gonna show you how to use that in your patients. So okay, you put in this form in your patient. Be careful with this step because you need to put in the correct way this part, right? In the middle of the arm of your patient. Put that in this part and secure that. So now in this part you can see two words, short words. It's a start and a stop. You only press on this and this start working. Look at this. Look at this. The little heart demonstrate that this code is working. So now we have three words in this part. Is seize, dia, and pulse. Seize is the name of this complete systolic pressure. Okay, this demonstrates the higher number, measure the force of blood against artery walls. And the day is diastolic pressure. This demonstrates the lower number and measure the force when the heart relaxes between beats. And the pulse, obviously, is the pulse of the patient. Okay? Thank you. I hope to enjoy the demonstrative class. So now we have the masks. Mask is so important. It's very important for protect, in this case, both the patients and the medical personnel from the spread of the infection, especially respiratory infections, right? Okay, there are masks. You can find it in a lot of different of colors or of maybe characters in print of this mask. So we have now gloves. Somebody help me with the meaning of gloves, please. Nayeli.
Gloves are primarily for protection and hygiene. They help prevent the spread of germs and maintain cleanliness in various settings, including medical and laboratory environments.
Yes, that's right. Gloves. There are gloves here in my hand. All medical experts need to use that because they help prevent the spread of germs, right? It's important to know that. So, stethoscope. Stethoscope is equipment for listening to a person's heart and lung. Nowadays, many medicals don't use that because it was replaced for this tool, right? Was replaced. So now, glucometer. I'm gonna show you a chronometer. Okay, that's it. Right? This is an equipment of you need. Obviously, you need when you do or take. That's it. Okay, what is glucometer? Glucometer is used to measure glucose, obviously, in the blood. This device indicates the amount of glucose in a small sample of blood. The blood is usually taken from the tip of the finger. So now, torundas and injections. This is a torundas. Torundas is a cotton balls wrapped in gauze and usually sterilized, used for various purposes in cures and surgical operations, right? There are a lot of torundas here. And obviously, the alcohol. So now, injections. This is an injection. 3 ml. Injections are a method of administering medicines or vaccines using a needle of syringe, introducing the medicine into different tissues of the body. So now, look at this. There are many different of size of the injections. So now I'm gonna show you a video about that. Please pay attention.
English Sing Sing.
Hospital. This is a hospital. 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 Wee-oo, wee-oo. The ambulance arrived with a sick person. Ambulance. Ambulance. Emergency! Emergency! This is an emergency room. Emergency room. Emergency room. Doctors perform surgery in the operating room. Operating room. Operating room. Sick people are staying in the ward. 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 People visit the doctor's office to see a doctor. Doctor's office. Doctor's office. This is a doctor. 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 Doctors wear white coats. Doctor's white coat. Doctor's white coat. This is a stethoscope. 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 This is a thermometer. 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 This is a nurse. 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 Nurses give us injections. Injection. Injection. Patients follow doctors' instructions. Doctors and nurses take good care of patients. Patient. Patient. Thank you, doctors and nurses.
Review. Hospital. Ambulance. Emergency room. Operating room. Ward. Doctor's office. Doctor. Doctor's white coat. Stethoscope. thermometer, nurse, injection, patient,
So now, based on the video of the vocabulary that you hear or you learn in this class, we have a little quiz. So about the vocabulary, right? The instruction is look at each pictures, this, read the description and choose the correct option for the name or use of the medical tools. So this is the picture and you answer the question. Please, Washington, can you help me? The question is, what tool is this and what is the use for? What do you think? Is the letter A, B, C, or D?
Okay, I think is letter B. Thermometer is used to measure body temperature.
Yes, that's right. That's the correct option. The correct answer, sorry. Nayeli, what do you think is the second questions according to this picture? A, B,
Okay.
C, or D?
Is letter C, gloves, used to protect hands from contamination.
Hey, good job. Thank you. And Jose, the last questions.
Yeah, okay, the last question.
Yes, look at the picture and guess. What is the correct option? Letter A, B, C, or D?
Okay. It's the A.
Yes, good job. A stethoscope is used for accumulation of the hair and lungs. Okay, guys. Thank you, students, for for coming in this class. In the next class, we have the unit number 2 with the item 2.3, supplies and protective equipment. Thank you. Goodbye, bye, bye, bye. Yo creo que sí se grabó porque me salió eso de... Sí.